and my mission today is to transfer these messages. Hypnosis is not something mystical, it's not something magical, it's an evidence-based discipline, and there are tons of evidences in that regard and support. There are a lot of supported clinical trials behind hypnosis. So let's jump into hypnosis with a concept called affective component of pain. Whenever somebody has pain, let's say chronic back pain, the first question we ask is how intensive the pain is. Let's say from 0 to 10, how intensive you are feeling the pain. This intensity is reflecting the sensory component of pain. But also we may ask how unpleasant is the pain, how unpleasant the pain is. And the unpleasantness, or how frustrative the pain is. And this frustration is reflecting the affective component of pain. In another word, affective component is called a metacognition. And metacognition is, by definition, a cognition about another cognition. You know, we are feeling pain as a simple sensory input, but it goes up to our limbic system, to our cortex, and it's associated with our memories and with a lot of other sophisticated cognitions in our brain. And the output is the affective component of pain. Most of the time, the affective component of the pain is neglected, and hypnosis is a great therapeutic modality to manipulate and modify the affective component of the pain. It doesn't necessarily mean hypnosis is not effective in the sensory component, but the main focus in hypnotherapy is on the affective component of pain. And it's very important about the role of affective component of pain in surgery or post-surgical satisfaction. You know, you may have heard that two identical patients with the same pathology, with the same imaging, like the same MRI findings, same CT scan, and with the same procedure, with the same surgeon, are experiencing different results from surgery. One of them is experiencing an impactful result, and the other one is not satisfied at all. Why is it like that? Because we should forget about thinking about surgery like a mechanical thing. It's not just relieving or releasing the nerve root, which is trapped between vertebrae. It is also a context of the pain. There is a context. We should have a holistic approach to a surgical treatment. So if we forget, my message is, if we forget about the affective portion of the pain, we will miss the context of the surgery. So it's very important to work on the affective component of the pain in post-surgical patients. And what is hypnosis? Can anybody give me a definition of hypnosis? Have you ever heard about hypnosis before? Hypnosis? Yeah.
Stop your mind and do whatever you want.
Yeah, stop your mind and do whatever
You want to be.
Yes and no. Stop your mind. Let's focus on the first portion. Stop your mind. It's true, because hypnosis, there are different, the truth is there is no definition, there is no consensus about the definition of hypnosis. There are different schools of thoughts. One definition of hypnosis is pretty much the same as you said, stop your mind. It is about critical judgment. Hypnosis is about, with that